My guest is renowned sport medicine physician, Dr. Stuart Willick, who is the team physician for US Ski and Snowboard. He's worked with athletes at all levels of competitive play, ranging from Olympic athletes to high school athletes. He's also heavily involved in research on the epidemiology of injury, and he sees athletes regularly at the Orthopedic Center at the University of Utah. It's a pleasure, Dr. Willick, to have you with me today.
Thank you very much for having me. It's a pleasure to be here.
Maybe you can talk a little bit more about your background as a practitioner and the roles that you currently assume.
Well, I have several roles at the university and elsewhere, and I have in the past. It will be a little hard to go through all of them. One of my primary roles at the University of Utah administratively is as director of the Sports Medicine Fellowship. I have served on the medical committee of the International Paralympic Committee. I have served as a medical liaison to the IOC during the Vancouver Olympics. I am one of the team physicians for US Ski and Snowboard, but that's a large pool. I've worked with other national governing bodies, including US Speed Skating, USA Climbing, and in addition to US Ski and Snowboard, all of which are located here in Salt Lake City. And the University of Utah is one of the national medical providers for the United States Olympic and Paralympic Committee, so I see their athletes as well. I have a clinical practice. I do a lot of teaching at the university, and I try to keep up with my research activities with a focus on sports injury epidemiology and prior focus on doping control and anti-doping.
Mm-hmm. What led to your interest in becoming a physiatrist, a sport medicine physician?
Well, there are many great fields within medicine, and there were many areas of medicine I was very interested in. I thought sports medicine was going to serve my intellectual and personal interests best over the years. It's just absolutely wonderful working with athletes, helping them prevent injuries, helping them move past injuries when they get it, and get back to doing the things they love, from elite competitive athletes to recreational athletes.
Mm-hmm. Maybe you can elaborate on what some of the enjoyable aspects of your work are.
Well, with regard to helping people stay active, I feel very, very strongly that physical activity is good for everyone. It keeps our heart healthy, it keeps our lungs healthy, it keeps our blood vessels healthier, our muscles, bones healthier. It's been proven to be very good for mental health and general sense of wellness and self-confidence. The list goes on and on. And as a believer in these benefits of physical activity and exercise, I find it very, very rewarding to talk to people almost every day about the benefits of exercise and general physical activity and help keeping them healthy enough to be able to participate. It's just very rewarding for me. I feel like maybe perhaps I'm doing a little bit of good in the world and having fun along the way.
Yeah. And I imagine there certainly are many challenges for a performer, an athlete, or an exerciser who's injured, and helping them to resume that activity, as you say, sounds quite rewarding or satisfying. Maybe you can talk a little bit about some of the challenges that an injured performer experiences.
That's a great question, Les, and a very, very important question. One of the primary challenges among many when an active person is injured and not able to do the things they love is that, well, it can be very frustrating. It can be frustrating for a number of reasons. One is they may feel like they're letting their teammates down if they're not participating. Two is they may feel like they're letting their coaches down because they can't participate. They may feel like they're letting their parents down or letting themselves down because they got injured. Everyone gets injured. Also, in particular for higher intensity athletes, endurance athletes, and some weightlifters. You get the endorphin high with your exercise, and endorphins are naturally synthesized opiate-like chemicals that are in our body, and the body makes more of them when we exercise. It's one of the reasons why exercise makes us feel good. And if you're not able to exercise, well, the endorphin levels can drop and people can just feel bad. So helping athletes get through that period in one way or another until they can get back to doing full training and full competition is just as important as the physical rehabilitation part itself.
Mm-hmm. So it sounds like there's a number of things that may be onerous or difficult for the athlete in terms of missing out on a self-defining activity, just not being able to participate in something that gives them satisfaction. You talked about the feeling that they're letting themselves or other people down. So maybe athletes are kind of hard on themselves and particularly so when they're hurt. And kind of also that idea of just missing the physiological benefits of moving their bodies and being active, which of course I guess athletes are used to do. Maybe you can talk a little bit about some of the uncertainties that an athlete faces or experiences during their injury rehabilitation.
Another great question, Les, and it's a perfect time to ask that question. People in general don't like uncertainties. And we are doing a Zoom interview right now because we're in the middle of the coronavirus pandemic. And we can't sit together at the cafe, share a cup of coffee and have a chat, or in your office and do the video properly. There are many, many uncertainties with the coronavirus pandemic, and that's very, very hard on the population. They want to know, when can I walk in the street? When can I run on the track? When can I take a hike in the mountains? When can I go back to work? When can I go back to school? And without having clear answers now for those questions, it's very frustrating. The same is true for athletes when they get injured, because there are going to be unknowns, particularly early on. Because early on, at the time of the injury, right after the injury, the athlete may not know exactly what happened, or they think they may know, and they think it's worse than it really is. As an example, athletes at all levels, and there's enormous variability. I mean, there's just as many personalities among athletes as there are personalities, coping skills, and resiliencies in the general population. But a lot of athletes, more so elite athletes, are very competitive and very driven. And part of that competitive drive is to have a regimented training schedule. On Monday, I have to do this. On Tuesday, I have to do this. On Wednesday, I have to do that to get ready for the competition in 3.5 weeks. And when they're injured, there are unknowns in the training schedule and unknowns in the competition schedule, and that makes athletes very uneasy. So the more we can give athletes, particularly these driven competitive athletes, some clear information and goals, no matter how small, that they can shoot for, it's going to help the athlete. And the general approach there is to give the athletes relatively small, easily completable goals day by day, and ramp up just very gently, much slower than the athlete would expect. And normal times when they're not injured, we have to explain that to them. But then they'll get a positive sense of accomplishment each day and feel better about their recovery process. And that all comes through transparency and clear information and helping the athlete with appropriate, reasonable, attainable goal setting.
Okay. So it sounds like a key part of your role as a sport medicine practitioner is to remove the uncertainty to whatever extent possible by providing clear guidance, information, and functional progressions or goals to help kind of assert more clarity over the process?
To the extent possible, absolutely. And when I'm not able to do that, I tell the athlete I'm not able to do that.
Right.
So if somebody comes in with an acute knee injury and it's painful and it's swollen and they're not able to train, and we talk to them about what happened and we do an exam, we may still not know the extent of the injury, in which case we say to the athlete, there are several things that could be going on here. Here are the structures we're concerned about. Please be patient. We should have the MRI in 3 days and we'll have a lot more information. It's important to be calm between now and then and be relaxed, but we will get to the bottom of this. We will treat this. We will get you back.
Mhm.
So we don't say, we don't try to provide information we don't have, but to the greatest extent possible, we do try to give them clear information. And if we don't have it, we'll say when we will have it.
Right. So it sounds like in particular that kind of time frame in the immediate post-injury aftermath can be quite uncertain when the diagnosis or the extent of the severity of injury is unknown.
That's correct. And unknowns and uncertainties are uncomfortable for everyone, including athletes who are used to being on a regimented training and competition schedule.
Sure. You mentioned that point about information and talking to the athlete about the nature of what's occurred. And maybe you can elaborate on the role or importance of information and education for injured athletes.
Yes, that's also very important. And it depends on what sense you get of what the athlete wants and needs. So some athletes really want to know every detail. They want to know the anatomy. They want to know the physiology of healing. They want to know the details of what might be done in the surgery. And they want to know what the post-operative rehabilitation course will be like on a week-by-week or sometimes even day-by-day schedule. And they want as much information as they can possibly get right away. So for those athletes, we're certainly providing more information. For other athletes, either they don't want to know, they don't care, or their mental framework at that time is such that they'll do better if you don't give them every detail, but give them an outline of what's going to occur over the next few days and weeks.
What do you attribute those differences to? Why, in your experience, are some athletes really keen on getting a lot of specific information? Others, you mentioned, either don't care or it's not of interest. Can you attribute that to something in particular?
I think the only thing I can contribute it to is the myriad of personalities in the general population.
Mhm.
And some people really are, they're planners and their minds will be unsettled unless they have information and details. And other people are more kicked back, laid back about various things, and they just don't feel a need to have so many details.
Yeah.
They're more go with the flow type of people.
Right. Is there such thing as too much information? Or, you mentioned the sort of the personality of the athlete who wants to know every kind of detail. Can an athlete be over-informed in some sense, or is there kind of...
That can definitely happen, yes. And part of my job is to try to get a sense of what's best for the athlete in terms of the detail of information. Certainly, if they're asking detailed questions, I'm going to provide detailed answers unless I think that it might just make them worry more.
Mhm. Injury obviously entails pain and is a painful experience. And I'm wondering if you can speak to the types of pain, either physical or psychological, that athletes endure.
Well, first of all, not all injuries present with a pain complaint. Sometimes it's a decrement in performance. We do see that. Injuries are more likely to present with pain for acute traumatic injuries. I'd say many or the majority of chronic overuse injuries become painful, but sometimes initially it's just a decrement of performance. A good example of that is in baseball pitchers, where the first sign of tissue damage in the shoulder is loss of velocity or loss of control for the pitcher. Sometimes we have athletes coming in and their chief complaint is not pain, but a loss of power, let's say. I just don't feel like I have the power.
Right.
And sometimes where they're feeling pain is not where the primary tissue damage is, but the area location of primary tissue damage. For example, if they fell on their hip 3 weeks ago and their hip muscles stopped working correctly, it might be affecting their knee mechanics. So we have to sort that out. Responses to pain and perceptions of pain, as with coping skills, as with resiliency, as with the need for detailed knowledge or not, is widely variable from athlete to athlete. And there are some athletes who I've known who break a leg and ski down the mountain on their broken leg. And there are other people who may have a minor sprain or contusion and they need to be taken off the ski hill by ski patrol. So responses are widely variable. For pain control, we generally start with simple things first: rest, ice, elevation to decrease swelling, Tylenol, anti-inflammatory medications. For more severe injuries like a fracture or broken bone, we do prescribe at times opioid pain medication for limited periods of time. And fortunately, with all the great information that's out there now about the pitfalls of opioid use, the general population, including athletes, understands that we're far more careful and don't want to overprescribe. And athletes take it much less than they used to. I see athletes declining offers for opioid pain medication after getting hit in the hand, the catcher getting hit in the hand with a baseball bat, or the basketball player having an ankle dislocation and things like that, right, where they'll take a small amount or something like that. But we do try to avoid that. And for more chronic conditions where pain's going on for months or maybe longer, we don't hesitate to get into what used to be known as alternative measures, but are now more mainstream: psychological techniques to decrease pain, acupuncture, CBD oil, safe options like that.
Yeah. Would you, in terms of pain, earlier you mentioned the loss of a valued activity. Is that something that, from your standpoint as a sport medicine practitioner, would fall under the umbrella of pain, or not necessarily?
I don't particularly view that as pain, but it is a huge problem. I say that both from personal experience as well as with working with athletes. Certainly, when I have an injury, it's rarely the pain that gets me down. It's the inability to function.
Right.
And to lesser and greater degrees, that certainly affects athletes. They may be upset immediately and crying out and screaming after a knee injury because they know they're going to miss their next competition, or they think they're going to miss their next competition.
Right.
Or they know it may affect their next contract or something like that. And that plays into response to injury just as much as the tissue damage and physical pain that they're feeling at the time.
Right. I've spoken to injured athletes who describe experiences where in the immediate aftermath of an injury, they're crying out or screaming, and they say it's not because what one would assume is from the pain of the injury itself, but exactly the point you mentioned about the fact that they know they've done something serious, and very quickly they understand that it's going to mean a prolonged absence or a potential absence that they don't want to have to endure or experience.
It's absolutely correct, and again, highly variable. I've seen two athletes with the same injury, let's say in a ski moguls course, and one athlete falls, crashes, gets up, skis down the side of the course. And the next athlete with the same injury is lying in the course, can't move, hollering in pain, and ski patrol has to take 20 minutes to try to get them into the sled and bring them down. And the physical injuries were the same. And it's just a matter of the psychological reaction to the injury can be highly variable.
I thought it was interesting, excuse me, that you mentioned maybe a move away from, or not a move away, but maybe a broader kind of strategy or use of different techniques other than just pharmacological ones to treat and manage pain. And you had highlighted, psychological, or you mentioned psychological strategies or maybe alternative treatments. To what extent are those being integrated more commonly or readily in terms of pain management, would you say?
I'd say to a very high degree. Of course, it depends on the injury. Some injuries hurt for a day or 2 days or 3 days, but for injuries that where people have pain longer term, and it's athlete driven. It's totally athlete driven. I mean, I would never say to an athlete, you have to have acupuncture. I would say to an athlete, you have many options for pain control right now. Let's talk about all the options and see which direction you want to go in.
Right. Is there value in kind of laying out those options rather than being more prescriptive in your approach?
Different providers have different approaches where some providers will readily tell the individual, the patient or the athlete, what they think is best. My general approach is to talk about all the options and then tell the individual, I have thoughts on what the best way to go here is, but I'm interested in getting your thoughts. And very often it's an agreement and a shared decision. Now, there are times when I speak more strongly in one direction or another. An example would be, and sometimes it's obvious, if the femur is like this, they're going to do better with surgery. In a young athlete who participates in a lot of cutting sports like lacrosse or basketball, if they tear their ACL, they're going to do better in the long run if they get that surgically reconstructed, in addition to doing all the rehab. So it does depend a lot on the injury, but it also depends a lot on the individual's wishes.
Yeah. Is there value in soliciting the athlete's input? You mentioned that's something you typically do.
I'd say I always do it, and I think it has to be done. So I value that very highly. The athlete has to be involved in their own care and decision making. We don't tell athletes they have to do this or have to do that, except in rare situations where it's an emergency or critically important.
So along those lines, would you say that it's important for athletes to assume ownership or responsibility of their recovery?
It's nice when that happens, but again, that is also athlete specific. So the athlete may say to me or another provider, please tell me what the best thing to do is. I trust you. What do you think is the best thing for me to do? In which case I certainly tell them what I think is the best thing to do. So different individuals have different decision-making capacities or just desire to take themselves out of the decision-making. Sure. And then some athletes will consult multiple people. They'll consult their trainer, they'll consult their coach, they'll consult a parent, they'll consult another athlete. How'd this go for you when you had this injury? Right. And that's perfectly fine.
Right. So for some athletes, it may be the case that, okay, I'm seeing Dr. Willick, and I know he's worked with the top level athletes, and I'm kind of happy to kind of put myself in his hands, so to speak, and follow his suggestions or prescriptions, whereas other athletes maybe are, as you say, kind of taking an active role and soliciting different perspectives or wanting to be maybe sort of initiate the path a little bit more. Would that be correct?
Yeah, that's correct. And one approach is not necessarily better than the other. But if they're with a team, so if they're high school or collegiate or pro, they'll presumably have an athletic trainer that they work with regularly. So we are often coordinating care with the athletic trainer, with their coach, in a team approach to the athlete's care that certainly involves the athlete. And a lot of injuries and their treatments are very straightforward, and there's not much question about it. You sprain your ankle, you need to do ankle rehab. But there are other situations that are more complex, sometimes without a clearly correct treatment, in which case it's really good idea for the athlete and sometimes for us to seek consultation with other people. I mean, I routinely run athlete injuries by my colleagues to get their input. And it's very fair for athletes to do the same.
Yeah. So it sounds like you mentioned a team approach. It sounds like there's communication between different stakeholders. Maybe you can speak to the importance of communication between, say, the athlete and treatment providers, or vice versa.
Well, it's the same as the members of a soccer team working together, practicing, talking during a game to coordinate the flow of the game and passing the ball and trying to win. The sports medicine team is doing the same. We're talking with one another. We're consulting with other experts. We're making sure the medical team's on the same of the same mindset and same approach. And for example, with the trainers we have at the University of Utah, that works really quite well because they're exceptional trainers. They're very smart. They're very well trained. They're very experienced. And we're generally all on the same page. And that helps the athlete a lot.
Yeah.
If the trainer and the doc and the physical therapist are all telling the athlete the same thing, and they go to their coach, and the coach knows that they have a good medical team behind them, they can say to the athlete, you have a good medical team behind you. They're all telling you the same thing. It's probably the wise thing to do.
Right. So when the athlete is getting consistent messaging from multiple practitioners, there's value or benefit to that. Is that right?
Absolutely.
Okay.
Absolutely. And one of the problems with athletes seeking opinions elsewhere, which does happen and we don't stop it, is that if they go to 5 different people, they could get 5 different opinions, and that's not going to be so helpful for them.
Sure. Do you have tips or suggestions for athletes directly that help facilitate their communication with providers such as yourself?
I would say to the athlete that they should educate themselves about the injury. They should not hesitate to speak with different people, and definitely their trainer, definitely other athletes they know and trust who have already been through this, because that's often the case, not always. If the team has a regular medical team behind it, like at a university or a pro team, and the other athletes and the trainers and coaches have all expressed comfort in that medical team that's backing the athletes, that particular athlete should also have a sense of comfort with the medical team. The athlete has to feel comfortable with whom they're working on a technical basis and on a personality basis. Those are very important.
Sure. So are there some specific factors that help build that rapport or that trust in the athlete in terms of their service provider?
Well, the most important thing we can do as providers is establish a track record of excellent care, excellent communication, timely care, getting the athletes in quick. Athletes get injured, they generally want to be seen same day or next day, or if they're on the road, they want to be seen as soon as they get back. And if the healthcare team behind the athlete has established a track record of excellent and timely care and communication and caring and kindness and compassion and good outcomes, then the athletes will generally have more confidence in their healthcare team, as to be expected.
Yeah.
And if the healthcare team is not doing a good job and is botching things, well, then it might be fair for the athlete to have some concerns or seek consultation elsewhere.
Yeah. So I could imagine certainly that when an athlete knows that they're working with practitioners and sport medicine physicians or athletic trainers with a track record of success, that would certainly build their confidence in working with that individual. I thought it was interesting though that you also mentioned those words caring. And I'm wondering, or kindness, how does someone in your role demonstrate that, or what are the things that you do to demonstrate caring or kindness to an injured athlete?
Well, many things, and I try to see the athlete quickly when they ask to be seen. That helps them. If I say, we'll see you in 10 days after they blew out their knee, that's not going to work. I try to speak to them in a kind, caring, respectful voice. I certainly try to listen to them, listen to their physical concerns and listen to their emotional concerns. And I try to reassure them that we'll do everything we can to help. And I try to follow up in a timely manner. So, for example, if I say to the athlete, we'll have the MRI in 2 days, and I will call you and coordinate with the trainer, or I will review it with our senior knee surgeon and we'll get back to you. Then I do that right away, and I get back to the athlete right away. And then the athlete has a sense that I care about them and that I'm trying to do everything I can in a timely manner to help them.
Yeah.
If an athlete needs treatment, then they want to get started on that treatment right away. Hey, let's get going. I got to get back to training. Let's get going.
Right.
And we try to do that if it's the safe thing to do.
Yeah. So it sounds like there are very tangible and concrete things that you do or implement that foster that sense that to the athlete that you're interested and you care about their success and their recovery.
I certainly try.
What you also mentioned this issue of time, but also earlier you talked a bit about those goals and functional progressions. And I'm wondering what happens if the two do not necessarily coincide. So specifically, if the athlete has a competition that they want to get back to in a month or 3 weeks, but the progressions aren't necessarily matching their sort of that time frame. How is that situation handled, or what's the communication there with the athlete?
Okay. First, getting to the first part of what you said about providing the athlete with daily goals to meet after injury. That's a joint effort. The strength and conditioning coach is usually involved, a nutritionist might be involved, the athletic trainer and physical therapists are involved in addition to the physician. And in fact, in terms of prescribing the specific rehab exercises the athlete needs to do, I may communicate my thoughts with a physical therapist or athletic trainer or strength coach, and then they implement it. And that's where trust among the different members of our healthcare team and training team come in really important. If there's a mismatch between the athlete's expectations and desired goals and tissue healing or their progress in rehab, that's one place where honesty is critically important. It's really important for the athlete to have appropriate, reasonable, achievable goals and expectations. And we as healthcare providers have to communicate what is reasonable and appropriate. And we have to do that in a way that's going to sit well with the athlete, or at least be okay with the athlete. There's a lot of research, Les, that athletes too often get returned to training and competition before their injuries are fully healed. We see this research in every sport, from roller derby to soccer to tennis. And what happens is then these injuries become longer lasting and lingering and recurrent. So I don't hesitate to tell an athlete about that body of research, that if we return you to soccer too soon after this ankle sprain, you're at high risk for a recurrent ankle sprain and you're going to lose more time.
Right.
But if we get you 99% better before we return you, and the return to training is a progression, then you're much less likely to have a recurrent ankle sprain and you're much less likely to lose more time.
Right.
And the athletes get that part.
So it sounds like there are instances where it may be beneficial to temper the athlete's desire to return to play. And in doing so, part of your strategy sounds like you refer to research that may indicate the detrimental impact of a premature return. Would that be accurate? Or
That's very accurate. And I think, especially with competitive athletes, they often want to progress faster than their injured tissue will allow. And we have to slow them down a little bit and explain to them, by doing the progression of rehabilitation more slowly, they're going to be more successful in their return to sport. And their performance will ultimately be better. And if we frame it in terms of performance improvement, they'll buy into the program.
right. So how that communication and messaging occurs, it sounds like, is important, or how it's framed.
Most definitely.
Yeah. Also, just as you were talking, I was thinking kind of about the athlete mindset in general, and like wanting to progress, and often a strong desire to attain athletic achievement and to sort of demonstrate competence, enhance their skills, and the sort of idea about progressions, and so I'm wondering kind of if there isn't some need to shift the mindset, or it's sort of like, okay, well, in this case, more isn't necessarily better, or quicker isn't necessarily helpful or adaptive. Is there some element of that in your work?
Shifting the mindset of athletes away from a driven competitive mindset is very challenging. I struggle with it in a few different settings. Right now, we are studying across the country injuries in competitive youth mountain bike racers. Okay, now mountain biking is a sport that takes place in the mountains on trails with rocks and roots and trees and uphills and downhills. And the goal is to get to the finish line as fast as you can. That sport is a great, wonderful sport. It improves athletes' strength and endurance. The governing body of that sport focuses on inclusion and diversity and health and wellness and getting people fit and having fun. But the sport is not without risk. So how do you decrease risk in the adolescent racing population, some of whom don't have fully developed frontal cortices, where the goal of the sport is to go fast, but to ride safer, it means slowing down in certain sections. How do you change that? When my kids were growing up ski racing, their coaches said to them in training, slow down to speed up, slow down to speed up. Meaning, when you're in training, slow down, work on your skills, work on your technique. That will ultimately make you a faster racer.
Yeah.
It's an almost impossible concept for young people to get, slow down to speed up.
Right.
But the fact of the matter is, if you crash on your mountain bike, you're not going to be mountain biking for a while. You may not be exercising at all for a while. You're certainly not getting to the finish line.
Right.
And if you can slow down in certain sections and not crash, your finish time will be better.
Yeah, sure.
If you don't get injured, your training will go better. Very difficult concept, especially for adolescents and youth.
Yeah.
It's a little bit easier above the age of 22 or 25.
Sure. So, some interesting contradictions, I guess, to sort out there that, as you say, maybe with the benefit of development, maturity, or experience, may be easier to kind of grasp. I actually want to offer a contrary suggestion to the point I just made. And that is that rather than shifting the mindset from sort of a competitive one to maybe a more cautious one, that athletes can actually apply the same competitive mindset as they do to their sport to their rehabilitation. I
Yes.
want to get your thoughts on that.
Yes. So athletes want to be successful in their sport. Many athletes want to be successful outside of their sport. And that's why I've been emphasizing this concept of small but attainable goals on a day-by-day basis. And the athlete will get a sense of success daily, no matter how small, but it will fit in with their athlete mindset of attaining success.
Right.
So if you say, do these many repetitions and these many sets at this weight, and you know the athlete can do that, and they will attain that goal, they'll be ready for the next goal. Their progress will keep going forward. They'll have a sense of success every day.
Right.
The other thing, again, which I mentioned before, is explaining to the athlete and helping them to understand that if they follow the rehab program, they're likely to get back to sport sooner, and their return to sport and competition is more likely to be successful than if they try to accelerate their rehab program beyond what the damaged tissue can stand.
Right. So again, the importance of that education and that information piece, and giving them, information that, well, listen, if you do too much too soon, or if you try to expedite the tissue healing that takes X amount of time, for example, that may ultimately come back to hurt you rather than,
Yeah.
help
So,
you attain what you want.
so rather than changing the athlete mindset, which might be harder, working with the athlete mindset um, to help them feel good about their rehab on a daily basis.
Right. And, it sounds like you mentioned goal setting. Again, athletes are used to doing that as part of their regular structure and
Yeah.
routine. And, also, of course, sport entails some physical pain when you're sprinting, and so, I would imagine that applying some of the pain management techniques they use to training could also be applied in a rehab setting, or, you know, for many high performance athletes, I'm sure there's some element of self analysis, or, they're kind of analytical about what they need to work on and improve, and where there are deficits, and maybe what they need to do to address those deficits. So I really kind of like your point about, rather than trying to shift the mindset, it's much easier to just work with the mindset they already have, and applying the same skills and just transferring them to the rehab setting. Um, in your clinical practice, I imagine you've seen countless patients. What are some thoughts that you kind of hear conveyed, or emotions that athletes experience?
I say the most common one is, I just want to get back to training.
Mhm.
That's the most common one I hear.
Right. And so again, kind of that inability to do the training that they want to be doing at the moment, is that's difficult, or does that have implications for their emotions?
Could you rephrase the question, please?
Yeah, sure. So I guess when you hear athletes articulate statements that, they just want to get back to their training, does that sentiment, or that statement or thought, seem to have any implications for their emotional state? So sort of like differentiating the thought from the emotion.
They're certainly linked. There's a frustration in not being able to train or compete. and it can get athletes down, just like if they're going through endorphin withdrawal, it can get them down.
Right.
I always tell the athlete, we'll get you back as soon and as safe as is possible, or as soon as safe as we can. Most people don't like being injured. There's a small handful who may, for psychological reasons, embrace injury, or for other reasons, like they have a dystonic relationship with their coach or their team, or with the sport in general, or with a parent who's pushing them, and they may amplify their injury symptoms. But or they may say, I'm just not getting better, when you would expect them to get better. And then you have to explore those possibilities. But the vast majority of athletes really just don't like being injured, and want to get back to what they're used to doing and what they love doing.
Right. So when they have that frustration, or maybe some of that negative affect or emotion, can you see any impact of that on behaviors, like how engaged they are in their rehabilitation, or like withdrawal kinds of behaviors, or maybe more positive things where they kind of channel the frustration and use it in some way?
It all depends on their coping strategies and resiliency. Most athletes will say, Doc, tell me what I need to do to get back, and I'll do it. I'll do everything you say I need to do to get back. And they'll embrace the rehab program. They'll embrace the treatments.
Right. You mentioned expectations before, and maybe you can just speak to that point or that issue a little bit more. What are some expectations that athletes have in terms of their recovery?
Okay, great. So if an athlete has unreasonable expectations, you used the example before of an athlete who wanted to compete in 3.5 weeks or something like that. So let's say you have an endurance runner who comes in with a stress fracture, and they want to run an ultra marathon in 3 weeks. If we allow them to have that unreasonable expectation, they're going to be very, very disappointed when they try to meet their goal and can't. But if we give them reasonable expectations, if we're honest and transparent, and we say, if you try to run 100 miles on this stress fracture, you'll have a real fracture, frank fracture, and you're going to miss much more time. And it's going to take much longer to get back to your activities. But if you follow these recommendations now, you'll get back sooner, and you'll be at lower risk for getting a worse injury. And I don't see any reason to set the patient up for disappointment, frustration, saying that I didn't tell them what was going to happen or anything like that, by allowing them to have unreasonable expectations. And it's all in the delivery. If you walk in there and say, young man, you'll never run again, they're just going to walk out of the office. So it's all in the delivery, and you have to explain to them, we're going to do everything we can to get you back to doing what you love to do. And we can get you back maybe even stronger than you've been by correcting these biomechanical abnormalities, make it less likely for you to overload that bone in the foot that's overloaded now, and make it less likely that you'll sustain a worse injury. And most people will understand that.
Yeah. So I was just going to ask you, do most people or most athletes, when you communicate with transparency and clarity, and you give them the scientifically based knowledge and information, do they embrace that typically?
Most, yes.
Yeah. Okay.
Yes. I remember one time having an athlete in with an overuse injury. He was a recreational endurance runner. Let's say he had a stress fracture in his leg. And I told him that if he kept running, it would get worse. And if he followed our recommendations, it would get better. He'd be more likely to get back. And he said, Doc, I understand. and I told him what the plan was, the rehab program. And 2 days later, I'm up in one of the mountain canyons and I see him running 3,000 vertical feet and 14 miles up the canyon. And then I saw him on the way back,
Yeah.
and then his tibia broke.
Hmm. Well,
So
so
not everybody listens.
yeah, I mean, and I wonder if part of that is like, is there something maybe particularly for endurance sports where there's kind of like this almost compulsive like element to the behavior and so even if you're being told rationally, well, you're going to hurt yourself, that it's such a ingrained habit that they continue doing that, or maybe that's hard to generalize.
Perhaps we see it more in some sports than others,
Hmm.
and perhaps running is not a bad example. But it's hard to pull runners off of running for a
Yeah,
while, and it's try telling a golfer not to golf, try telling a skier not to ski.
sure.
Gymnasts and dancers, have feel a lot of pressure to train a lot,
Yeah.
practice a lot. Um, so you can see it in any sport and you can see it at any age. Perhaps there are some sports where that mindset is more, distance runners have sayings like, if the bone ain't showing, just keep going. They'll just want to run through anything. We
Yeah.
certainly see our gymnasts training and competing with lots of injuries and pain, and they compete through them. We certainly see football players do it.
Yeah.
And I've certainly seen hockey players cut off their cast and get back onto the ice before being cleared.
Yeah.
So it can happen in any sport.
Yeah. You've alluded to this idea, but just to ask explicitly, maybe you can talk about the role of motivation, an athlete's motivation in injury recovery.
Yes, very important. It's as important as some of these other factors we talked about. It's as important as the nature of the tissue damage. It's as important as coping skills and resilience, and they're all tied together. If an athlete is not motivated to go through rehab, it's going to be a struggle for the rehab team and the athlete to get there.
Mhm.
Why might not the athlete be motivated? Well, it could be one of 100 reasons. It could be they've gotten depressed. Maybe they have underlying depression that was at a low level and became worse with the injury. Maybe they've never been depressed and they're depressed about the injury. It could be, again, as we spoke about, a relationship where they're not aware of or only partially aware of. For example, relationship with a coach, teammates, parent, and they're not having positive feelings about their sport anymore. It could be that they're at the tail end of their career. They've gone through injuries and rehab before, and they're thinking about, well, maybe it's just not worth it anymore. So motivation can go down for any one of a myriad of injuries, and it is important to explore it.
Yeah.
At the professional level, depending on what sport you're in, sometimes there are financial considerations to either get back faster or not get back faster.
Right. So there may be, I guess when you're talking about motivation, is not kind of just the amount or how much motivation, but it sounds like there may also be different sort of reasons or sort of factors that drive the athlete, whether it's, as you say, financial considerations or maybe other factors.
Yeah, Les, another factor could be, there are some young athletes, maybe they're 16, 17, and they've always excelled. They're incredible athletes. They've always been the best in their class, the best on their team, and they never took training very seriously. They never went into the gym. They never stretched. They were just good at it. Good for them. I'm jealous. But then they get injured, and to get back, they have to do rehab. They have to do these exercises, and they're not used to doing it, so they're not motivated to do it. That could be another reason.
Yeah, sure. Do you have any sense of whether, I guess, those different reasons that are driving the athlete to return or motivating them, are some better, for lack of a better expression, or worse in terms of there are implications for how committed the athlete is to the rehab, or what the outcomes, the functional outcomes might be?
It's different for everyone, but I will go out on a limb and say the best motivation is love of the sport and love for exercising.
Why?
Because I see that as more of a pure motivation. It's like pursuing knowledge for the sake of knowledge.
Right.
Another great motivation is wanting to help your teammates. Or if you have a wonderful motivating coach, wanting to help your coach. Those are those personal and interpersonal motivations,
Yeah.
I think, can be very positive.
Yeah. Well, I can tell you there is some empirical evidence to support your statement. And just as a brief aside, when I was studying or starting my doctoral studies, my supervisor, Bob Eklund, and I essentially thought, well, coming back from injury is at its core a motivational issue. And so we had, I think it was a couple hundred athletes who had returned to sport, and athletes at fairly competitive level from Canada, England, and Australia. And we asked them about their motivations, their reasons for returning. And so they completed a questionnaire that asked them, like, why did you return? And some of the motivations were more intrinsic or pure that you mentioned, like a love of the sport. Some were more external, like wanting to maintain scholarship or financial reasons. Some were guilt. If I don't return, I'll feel bad for letting my teammates down. And then we also asked them about their perceptions of their post-injury performance. And so, there were kind of two main kind of outcomes in terms of post-injury performance. One was more positive returns, where they felt like they had more mental toughness or they were performing at a high level, whereas the other category of outcome was more negative. So they felt like, they had more apprehension about getting re-injured, or they were, they felt like their performance was worse in comparison to pre-injury. And we did find some associations between those intrinsic motivations and the more positive or adaptive return to sport outcomes. Whereas on the other hand, the more intrinsic motivations were associated with what we called return to sport concern, so those negative outcomes. I guess just a little bit of evidence to support your statement there.
Yeah, physical readiness to return to play is critically important. Is the tissue healed? Is the pain gone? Psychological readiness to return to play is as equally important.
Yeah. Well, I don't know if you're telepathic or if I just segued into that question from my little anecdote there, or empirical story, but I was going to ask you about how decisions are made, or determinations about when athletes are ready to resume competitive play.
We use a multitude of factors. We use sometimes performance on standardized testing of physical performance. For example, if an athlete tears their ACL, is their quadriceps strength on the injured side back to close to what it is on the uninjured side? Is their hamstring strength the same? What does the ligament feel like when you test it with your hands? Is it solid? Does it feel, is it move, are the bones moving too much? How does the athlete do with easier box jumps, easier jogs? How does the athlete do with bigger box jumps, side to side movements, cuttings, faster sprints? How does the athlete do with dynamic activities? And we progress them up on a day by week by week basis. And are they checking off all the boxes? And then, of course, in addition to those physical measures, we ask the athlete about their psychological readiness to return. But that's not as standardized, or perhaps not standardized at all, like the physical measurements are. And perhaps we could do a better job assessing athletes' psychological status when they're injured in a standardized manner, and their psychological readiness to return to play in a standardized manner. I think those would be quite helpful. rather than saying, you feeling okay, okay, pat on the back, go get out there.
Right. So it sounds like for, I guess, many injuries, there are certain physical tests or parameters that are indicative that the athlete is ready to go when they can kind of show a certain competence on those skills. But with the psychological readiness, it's a bit more vague or ambiguous. Would that
That's
be
that's certainly true.
okay? Are there any signs from your perspective as a sport medicine provider that the athlete is psychologically ready, or conversely may not be ready? The psychological side.
Um, that's also team approach. So I rely on what the athlete's telling me. I
Mhm.
rely on what the athletic trainer or strength and conditioning coach is telling me. Rely on observations of the coach. If the athlete has been working with a sports psychologist through the course of their injury, sometimes they do, sometimes they don't, then we certainly rely on feedback from the sports psychologist,
Right.
who will have a much better understanding of psychological readiness to return to play than I would.
Sure, sure. But it sounds like there is some sort of, I guess, comprehensive, I think was the word you mentioned, or like multiple attempts to get different dimensions of the athlete and whether they should be or whether they're ready to return to play.
At times, for less severe injuries, more straightforward injuries, we don't go through that much of a process. Like
Right.
a grade 1 ankle sprain, a mild ankle sprain. The trainer and I will get the athlete started in rehab. The trainer and I will consult and usually we'll agree when the athlete is ready. We certainly consult with the athlete. Do you feel ready to go back to play? But it's not more standardized than that. Where it really comes into play is when more significant injuries, the athlete has been out a longer time, the athlete has struggled more with their rehabilitation, either physically and or psychologically. That's when we'll consult with more people rather than fewer people. For example, have the athlete sit down with a sports psychologist.
Right. So injury severity sounds like it has significant bearing on the extent to which readiness to return is relevant or to which it's assessed. It sounds like,
Yeah, and the length of time the athlete's out for is very important.
right. And
Shorter injuries are easier to cope with. The timing of the injury is also important. So if an athlete breaks a bone on the last day of the season, that's less upsetting to them than if they break a bone on the first day of training or the first day of the season.
yeah, I imagine when, you're in the final match or competition and you're about to win the championship and in the last minute you hurt yourself and your team's won, it's probably a different prospect than
Yeah, you celebrate with your team, you deal with the injury later. You
right,
take some time off.
right. You've talked about this in different parts of our discussion, but I want to touch on this issue more explicitly. What are some of the different types of support that injured athletes need or benefit from?
It's different for every athlete and it's different depending on the injury. Again, minor injuries might be a few days, might be a week in their back. They don't necessarily need support. But as with any issue that arises in life, it's nice for people to have a support network. Support network can come from a lot of different places, certainly can come from teammates. It's important for the coach to be involved if it's a more significant injury, the athletic training staff, the strength and conditioning coaches, the medical providers, the physical therapists, friends and parents, all those, a sports psychologist, all those can be great support resources for the athlete.
Yeah. So we've been talking about the fact that injury is not something any athlete, or most athletes, want to experience, unless there are other factors where maybe it's a welcome relief. But in general, it's an unwelcome event. I'm wondering, are there potential benefits or upsides to an injury?
There can be. It's a great question, Les, and thanks for asking that. What comes to mind is that over the last 10 to 20 years, we've seen this trend of, particularly in youth athletes and adolescent athletes, of doing too much. Sports have more and more become year-round. We see athletes playing on 3 soccer teams in one season, and there's very little downtime. I've seen 12-year-old baseball players with shoulder pain who played 100 games in the last 12 months. That's just simply too much for a 12-year-old shoulder. There's no question about it. And it's very hard to pull back on this early sports specialization and overtraining in youth athletes. It's pretty clear that young people do better if they participate in multiple sports. You asked the majority of Olympic athletes what sports they played when they were younger, and they said, I did everything, I loved doing everything. And young bodies do better if they mix up their activities throughout the year. So a period of enforced rest on a young body can be very, very helpful for their growth and development. In certain sports, gymnastics comes to mind. The nature of the training in the sport can have effects on growth and development, like a decrease in growth and development. Once the young person is done with their gymnastics training competition, we start seeing them develop and sprout up in height. So it can be good to give the body a rest from a period of very hard or prolonged training, especially the youth body, but the adult body also. Periodization in training is critically important. Recovery days are critically important. Adequate sleep and nutrition are critically important. I'm not sure that information has gotten to all coaches and all athletes, particularly at the adolescent and youth levels.
Yeah. So it sounds like an enforced period of rest can be needed, particularly, as you mentioned, for younger athletes who may be engaged in what could be characterized as excessive training volumes or levels.
Yes.
Are there other possible benefits to an injury?
Well, the concept of athlete burnout is a challenging one because athlete burnout can have physical and psychological manifestations. And the contributors to athlete burnout and why one athlete might get it and the next 98 athletes won't get it are really not clear. But if an athlete who's feeling burnout gets injured and has a period of enforced rest, it could potentially rejuvenate them and renew their enjoyment in their sport.
Yeah. Well, I certainly know of some evidence that indicates the importance and value of recovery in mitigating burnout symptoms. And I think your point about the role of overtraining, or I guess maybe an absence of recovery, can certainly increase burnout risk. So those are great points. 2 other questions just before we finish, and I very much appreciate all your insights. Are there factors that distinguish athletes who are able to make a successful return, however defined, versus those who are unable to do so?
There most certainly are, and I wouldn't pretend to know all of them, but they're similar to the factors we've discussed already. And one is the nature of the injury, the nature of the tissue damage. There are some injuries that are severe enough that an athlete may not get back to their number one sport, but hopefully they'll be able to do lots of other sports and stay active. The athlete's ability to comply with the treatment program and the rehabilitation program is very important, because if rehabilitation is needed after the initial injury, or perhaps after a surgery or other treatment, perhaps an injection, and they're not willing or not able to do the rehab program for whatever reason, they're going to have a harder time getting back. And as we've already spoken about several times, the importance of resiliency and coping skills are critically important. Mm-hmm. If the athlete's frustration gets so high that it interferes with their recovery process, that's certainly not going to be helpful.
Yeah, okay. My final question, if you could share one piece of advice for injured athletes, what would it be?
To accept and recognize and understand that there are always unknowns in life. There are often unknowns with injury about the time frame for recovery. And if you can't accept those unknowns, your recovery process is going to be much more frustrating to you. And it's better to be calm and patient and a little bit on the Zen side and follow the recommendations of your healthcare team and ask for and make sure you receive and work with attainable daily and weekly goals during the rehab process, things you can work toward. Your healthcare team is here to protect your long-term health and safety and wellness. The healthcare team is working with you to get you back to doing all the things you want to do as soon and as safe as is possible. And sometimes that's a little quicker, sometimes that's a little slower.
Mm-hmm. Yeah, and I think that's a great point about kind of calm and patience, and particularly, of course, in a circumstance that for many athletes, as you've described, can be frustrating and emotional or uncertain. So thank you very much for your time, Dr. Willick. It's great to speak with you, and I always enjoy the opportunity to do so. So thank you very much.
No, thank you. It was a real pleasure for me. I found it to be an intellectually stimulating and important conversation.
Likewise. Thank you.